I'm afraid because my sister died from this. My family members died from this.
That's the only part about that interaction that you really need to know. There's a patient who looks like they're being discharged and they're afraid because they've had family members die from something. You can literally insert anything from appendicitis to COVID. The illness doesn't matter. The issue here is that there's an obvious disconnect between the medical team and the patient. So for the sake of recency, let's talk about COVID for a second. The treatment for COVID has changed so dramatically in the past 4 years, and it's hard for providers to keep up to date with the changes, let alone patients, especially people who have no medical training or a limited medical literacy. Oftentimes, the only thing they know to be true is, hey, my family member died from this, and now I'm all of a sudden being discharged. Whereas other people were intubated early, put on prone, put on steroids. Ivermectin was a thing. Hydroxychloroquine was a thing. Antivirals, which people don't understand the difference between antivirals or antibiotics before COVID, let alone now. And there's certain criteria. Are they on oxygen? Yes or no? Do they have risk factors? Are they elderly? Are they immunocompromised? And that would guide our decision making, which is intuitive to us as healthcare people. Who gets antivirals, who gets monoclonal antibodies, who gets admitted to the hospital, and who doesn't. It's very intuitive to us, but oftentimes we don't explain that in a way to patients. And we just say, hey, take my word for it. You're being discharged from the hospital. I know your sister, who's probably about your age, died from this, but, I know best, right? And let me remind you, this is TikTok, right? This is not medical advice. I don't know anything about this guy or the healthcare team or the disconnect or if he's being admitted, discharged, none of that. But that's not what matters here. What matters is it's not that hard to establish rapport with a patient to make sure they know you're on the same team as them. That's obviously not the case here. And whether or not medically they're doing the right thing, socially, which is 80% of this job, it seems anyway, they are not doing the right thing. And if you're not able to communicate in a way that your patient with limited health literacy can understand, that's your fault. If you're only able to explain things in terms of guidelines but not intuitive sense to a patient, that's your fault. It's not the patient's fault because it's not their job.